our last speaker this morning, Dr. Thakur. He's professor at the Center for Public Health, the School of Health System Studies, and the TATA Institute of Social Sciences in Mumbai. He is an expert in public health and epidemiology and has been studying public health in developing countries. Please, Dr. Thakur. Thank you.
I think there is some problem with okay, no problem. So, Suprabhat, Namaskar, my fellow human beings, and I am very glad that I am talking in front of you on this very important topic of waste management, and particularly public health issues in waste management. So what do you mean by waste? Okay. So till a few years back, waste was considered as unwanted or unusable material, or any substance which is discarded after primary use, worthless, defective, or of no use at that point of time. Who are basically waste handlers? So basically, let me tell you, I was writing my notes on this particular paper. So when I was writing my notes, it was a resource. As soon as I finish my writing, I finish my presentation, it is of no use to it, and then I throw it. So this is the waste. Okay? So basically, waste is a resource at wrong place. You used it, and after your use is over, you throw it, and then it becomes a waste. And this way, with this better understanding, we are now using and converting resources into waste, and now it is being considered as a resource at wrong place. So waste is nowadays considered actually useful since our resources are limited. We know that we have only one Earth. There are limited amount of resources. We have human beings, other living beings living on this Earth. So these resources, scanty resources, they have multiple uses. Once you use this resource, then it cannot be used for any other purpose, and then it becomes a waste. So you have to see that that resource has to be used efficiently and effectively, and then you can reduce the generation of the waste. So for this, it is essential that if we have created waste, if you have generated waste, you reconvert that waste into a resource again for future use. So what are the different types of waste? There are many classifications. One is biodegradable, non-biodegradable. Biodegradable obviously will be converted by Earth into resource again. It might take years, might take decades, might take centuries. Then there are non-biodegradable waste. This will not take, this Mother Earth cannot take care of this type of waste. This will remain for millions of years. Then we have solid waste, liquid waste, gaseous waste. Another classification, we have municipal waste, which includes household waste, commercial waste, construction waste and demolition waste. Then we have hazardous waste, which can be created from industries, radioactive materials, explosive waste, electronic waste, e-waste, and again we have another important part, that is a biomedical waste, which includes clinical waste generated by health facilities and health providers. And don't forget that we have agricultural waste as well. Particularly, I would like to emphasize on this electronic waste. Now we have these mobiles. These mobiles, we use them as a resource. Okay, so we get lot of material, useful material from Facebook, internet, WhatsApp, whatever. Okay, after some times we get so much material that it becomes a waste. Okay, because our limited space cannot accommodate it, and then we have to throw it, make it clean. But after some times, our technology experts, they come up with new models of mobiles, and then they promise us that you can handle more resources, you can use more space. This is like saying that we have only one Earth, and now our Earth is not capable of sustaining this much of population. We have to look for some other planet so that we can go there and migrate. Okay, coming to per capita waste generation. Now this is a very simple graph. On x-axis you can see the municipal waste generation kg per person per day. Okay. On y-axis you can see the GDP, gross domestic production per capita. And as you can see on the top, the USA, Australia, Germany, Japan, these are the developed countries. Their per capita income is very high, GDP is very high, and you can see that their waste production is also very high per capita per person per day. On the lower end, you can see India. India, the per capita income is very less, GDP is very less, and their per capita generation of waste is very less. This is relative. This is in terms of per capita per person and GDP. But in absolute numbers, there is another problem. In India, we have population explosion, and because of absolute number of population living in India is more, we produce more waste as compared to developed countries. Again, I would like to emphasize more important point here. Few years or few centuries back, 16th century, 17th century, majority of people living in Europe, they were having similar problems like we are facing nowadays in India. Okay, so what they did, everyone knows that they migrated to new places. So they went to USA, Australia, and they discovered new places where they can sustain themselves. So, but Indian people are still here, and that is the one of the most important reasons why we don't have space to accommodate. We have to miss our population explosion is there. And now, again there is another problem. We have to search for new places to stay, and we are searching for places outside Earth. Okay. Now let us come to most important point. What is the importance of health in waste management? As all of us know that sustainable development is a very important concept, and this is very simple definition given by UN, and it is the development that meets the needs of the present generation without compromising the ability of future generation to meet their own needs. So basically we are talking about present generation. Present generation has their own needs, yes, that we accept. We have to meet our needs, but don't forget that we are not here for misfit, we are not immortal, we are not going to live here permanently. So there will be future generation, and they will also have their own needs. Okay? So we exploit all the resources for ourselves. Future generation will be left without any resources for themselves. And the only thing they will blame is our generation. So basically the sustainable development is a socio-economic development that is conducted without depletion of natural resources. And as said by Mahatma Gandhi, Earth provides enough to satisfy every man's needs, but not every man's greed. So we have to differentiate between need and greed. There is a difference between need and greed, and health is one of the most important basic needs. Health, safe drinking water, basic sanitation facilities, good food to eat. So these are the very basic needs that we have to satisfy. The problem is human beings. Human beings are not satisfied with what they get. If you get 1 BHK flat, now you want 2 BHK flat. If you get 2 BHK flat, you want another second house. If you get second house, then you want holiday home. So our demands are day by day increasing, and that is what is called as greed. So we have to take care of our greeds, we have to concentrate on our needs, and that will only be possible to have a sustainable development. And so health has very direct relationship with development, and many diseases are directly or indirectly related to waste. I will come to that in further slides. You can see this waste collection side. I have shown you the waste generation. Waste generation is very simple. This happens every day and every home, every place. We are all responsible for waste generation. Don't think that others are creating waste and you are only trying to reduce the waste generation. So these are the waste collection side. These are seen not only in developing countries, these are seen in developed countries as well. But this side, waste disposal side, these are the most important characteristics which are seen only in developing countries. Why? Because the technology to manage this particular disposal is not available with them. The resources to manage this waste disposal is not available to them. And these resources are available, these technologies are available with developed countries, but they will not give it to you unless and until there are many issues there. They have what you call I think rights. Okay, so they have rights, they have to buy these particular things, all these things are there. And as you can see, this is the waste disposal side. We have already been told that we try to divide the waste into three parts: solid waste, degradable, biodegradable. Segregation is done at household level. But at the end, at the waste disposal side, everything is together. Okay? Whatever efforts we are putting during waste generation at household level, our society level, all efforts go in when the waste ends up in disposal sites. And you can see here the dogs are running amok, there are birds, flies, rat pickers, even our other poor fellow human beings. They are forced to survive in this particular waste. They are trying to find out the ways to survive. Okay, another example I would like to give is we have Devana dumping ground, that orange circle you can see. So that is the Devana dumping ground, one of the biggest dumping ground in Mumbai, and intentionally or unintentionally, there are sometimes fires broke out there. Okay, so whenever there is a fire, you can see the smoke or pollution coming out. And here we are sitting here in this Trident Hotel at another end of the Mumbai, and we feel that we are quite away from that waste disposal site and the fire. But actually you can see the smoke flows from there to everywhere. Okay? So though we feel that we are safe, we are not that safe. Now for any disease to occur, it can be communicable disease, non-communicable disease. There are three important factors: agent factors, host factors, and environmental factors. And the waste plays an important role in all these particular factors. For example, agent factors, biological factors, the viruses, bacteria, parasites, all these are transferred from waste to the new susceptible host. The physical agents, chemical agents, nutrient agents, all these are transferred from waste. Then we have host factors like demographic factors. The young children, infants, the adult geriatric population, all these are more affected by diseases compared to other population. Then biological factors, socioeconomic characteristics, lower socioeconomic people, they are forced to live near the waste disposal sites. They cannot defend themselves, they cannot go to high-end site, and they are forced to stay nearby, and they are more affected by it. Then we have behavioral characteristics. Behavioral characteristics play an important role. Our health and hygiene practices, knowledge, attitude and practices, very important role here. Then we have environmental factors: physical environment, biological environment, social environment. I will not go into details of this. Means this will take 2-3 hours. Okay. I will talk only about few communicable diseases, few non-communicable diseases. And as you can see, communicable diseases, there are two types of modes of transmission. One is direct transmission, another is indirect transmission. So direct transmission means when you are, for example, skin to skin contact. Okay? For example, you are in contact with a rat picker. So if he is affected by some skin disease, you will be directly getting that disease from him. Then you have droplet infection, somebody is coughing, you are within the vicinity, 2 to 3 meters, you will be affected by that particular organisms transmitted by you. And contact with soil contaminated by waste, that will affect you. Inoculation into skin or mucosa. This waste can contain hazardous things, okay? Needles or mechanical problems, needles or some health medical equipment. This can be dangerous. Then there is a transplacental, which is not directly related to waste. Then you have indirect transmission. These are very important factors because we don't see that waste directly leading to diseases. Okay, the direct transmission is quite less, but indirect transmission is more common. For example, waterborne diseases like diarrhea. This is most commonly transmitted from liquid waste or solid waste to new susceptible. Then you have vector-borne diseases. For example, malaria, dengue. These vectors, malaria, mosquitoes, these breed on dirty water or stagnated water. Okay, and this will transmit malaria or dengue organisms from the person affected to new susceptible host. Then you have airborne route of transmission, fomite-borne. Fomite-borne means, for example, again this mobile. The mobile has many bacteria and viruses because we are handling it inappropriately. It is placed in many places and it contains many bacteria and viruses, and if you use somebody else's mobile, then there is a chance that you can get the disease from that particular use. Then unclean hands and hygiene and fingers. This is another important thing related with your behavior. Okay, I will go into fecal-oral transmission, how the bacteria and viruses or parasites present in a person who is affected by a particular disease go from that person to somebody who is not affected by that particular disease. So somebody who is affected, that person's feces, if there is an open air defecation, that can go from fluids, liquids, water, fields or floors, flies and fingers. There are 4 routes. From this it can go to food, and if you consume that particular food, there is a possibility that you can get the disease and you can suffer from diarrhea or some other disease. So we need to have some barriers. For example, toilet barriers. We have Swachh Bharat Abhiyan. Under that we are trying to create basic sanitation facilities. If you have toilet barrier, you can prevent transmission of organisms from fecal matter to fluids, floors and flies. But you cannot avoid to fingers. From finger to flood, it is still possible. If you have safe drinking water, then you can prevent the transmission from affected fluid to the food. Okay? But you can see that hygiene and hand washing behavior, if you can inculcate this particular behavior in all the individuals, then it is possible that your food will not get contaminated in the first place, and then if you are consuming any food, there is a very high chance that you will not get the disease. So the behavior, the basic hygiene facility, knowledge and practices are very, very important to prevent the fecal-oral transmission. These are the key health problems caused by air pollution. You have asthma, cancer, respiratory problems, heart disease, birth defects, intellectual disorders, tuberculosis, immune system damage. So actually you can see all the diseases we see in hospital or health clinic, all the diseases are directly or indirectly related to waste. Okay? So waste means health is wealth. So if you want to remain healthy, you have to see that waste is managed in a good manner by not only you but by others as well, and it is your responsibility if you are a parent, it is your responsibility that you inculcate good practices and knowledge among your children. If you are a teacher, you have to see that all the students follow these particular practices. If you are owning a company, you have to see that your company follows all these practices. So what are the effects of waste on living world? So initially I told you that we are all human beings because this conference is attended only by human beings. Okay? But there are other living beings. We have animal world, plant world, we have birds, sea animals. So all these animals are there. But unfortunately, they are not that intelligent. Okay? Only human beings are intelligent and we are trying to exploit all the resources. All these resources actually belong to all the living beings. But as a human being, we are taking the benefit, and basically what is happening is that, for example, solid waste, we are getting diseases due to flies. Liquid waste, fecal transmission, I have told you, we are getting diseases like communicable diseases due to mosquitoes. And we have gaseous waste, air pollution leading to respiratory problems, cancer, etc. Others like low birth weight, congenital malformation, or other cancers. And remember, it is not that only developing countries are affected by it, even the developed countries are affected by it. Means this waste pollution does not know any boundary. Okay? They don't recognize international, national, local boundaries. They will travel everywhere. And that is the reason for global warming, climate change. It is affecting each and every country equally. And that is the reason why developed countries have recognized that they have to go into developing countries and try to save their own citizens. Okay, we should not forget that waste also has effect on plants and animal kingdom, and this is leading to deforestation, extinction of species, loss of biodiversity, climate change, all these things. Okay, so what is the solution? I think all of us are familiar with this waste management hierarchy. We have inverse pyramid. Inverse pyramid means we should try to give more attention at the upper end compared to lower end. Okay? So at the upper end we have avoidance, means you try to not generate the waste, and then reduction. Okay? Or you can say instead of avoidance, refrain yourself from generating waste. Refrain and reduce. So that is where we need more technology. Okay? That is the primordial prevention. Reduce. Then, if you have to generate the waste, then you try to see that you reuse it again and again. So that is the primary prevention. So primary prevention, you have to put more effort, more technology, more knowledge. And in spite of all this, if waste is generated, then your secondary and tertiary prevention comes in. Secondary prevention, you have recycle, recover, and tertiary prevention is the last stage, that is landfill, and that is like a rehabilitation. Okay, you have already damaged everything. Now you are trying to means do something so that it does not look like a damage. And these are the famous R: reduce, reuse, recycle, recover. I will also like to add more R's. We also require research and trying to identify more and more technologies to see that we put more and more efforts at the upper level. Then we also have to realize like awareness. So we have to realize what is the importance of waste in our life. What is the importance of waste in having healthy and wealthy life. And then next R is reassess. You monitor what is the progress made. You don't just make the technology and give it, distribute and forget it. You reassess, is it really useful? Is it serving the purpose? If there is any problem, try to resolve it. So, the problem which I have seen is that we are putting more and more attention at the higher end, lower end, and not at the higher end. The technologies are more available at the we are putting more effort at the lower end, the technologies are available here, but we require technologies at the higher end. So what are the challenges and issues? So one important challenge is dumping of waste, especially from developed countries to developing countries. This is the most important thing. As a common man, we are not aware about this, but this is the reality. Especially the hazardous waste. Hazardous waste is commonly dumped from developed countries to developing countries. Then from cities to rural, tribal, forest areas, we think that as urban people, we are more important. And from land to sea, river and water bodies, that is another more hazardous thing. And from earth to space. Actually that is happening, but in small scale, but that might be a reality in future. Okay? You might have read that there are many satellites wandering around the earth. Okay? So that is the reality. Again, another second important issue is modern waste management technology need to be more focused on reducing waste generation, reuse and recycle. And next important thing is it should be available, accessible, affordable and adaptable at local level. Okay? These A's are important. And especially it is not made available to all, especially to developing countries. Developed countries using their more resources, especially financial resources, technological resources, which are migrated from developing countries to developed countries. From here we produce more and more intelligent people from IIT. They go to developed countries and they make their resources, technologies available to them. But these technologies do not come here. So this availability, accessibility, affordability is a very important issue. And last is lack of awareness among citizens, common man, policy makers. These are very important. Okay, last slide. So what can be done? We require more research, basically to understand what is the social, economical and political impact of health-related issues of waste management, and we have to also understand what are the determinants of this. So determinants and impact of these particular issues. Then next is we have to try to link health and development. We have identified sustainable development goals, and all the countries in the world, they are bound to achieve these particular goals. So these are very important. And then most important is creating awareness among common man, waste handlers, and the most important people are policy makers and policy implementers. We require more awareness upon them. Unfortunately, India has become independent since last 70 years. Before that, we were exploited by foreign powers. They exploited our resources. Resources were taken to their countries. But now, in spite of independence since last 70 years, we are not able to take care of our poverty. And the main reason is the technologies are developed, technologies are marketed by developed countries to developing countries, and our policy makers, policy implementers, they go to, for example, I think next week, our 10 senior people are going to USA to get those particular awareness about these technologies. They might not use it. Immediately after coming back, they will be migrated, they will be transferred to another post. But that is the most important place where awareness is required. Thank you very much.